Today I'm talking a bit about mystery cases. How do you do your research? Now, as a vet in practice, mystery cases are really the things that make my job enjoyable and fascinating. Most of my day's work is made up of fairly routine stuff. You know the way: annual health checks, vaccinations, skin disease, dogs with arthritis, um, small lumps and bumps. Those are the kind of medical cases I see. And when it comes to surgery, it tends to be, again, fairly routine sort of things, so spays, neuters, small tumour removals, maybe dentistry. Now, much as I enjoy all those aspects of my work, they're not the bits that really intrigue me. What I find thoroughly enjoying is the mysteries, is the dog that comes in with a strange combination of signs, like the increased thirst combined with the weight loss combined with the cough, something like that, and you're going, okay, well, what's the unifying factor here? What's the one underlying cause of all of these different signs? Or maybe there's a cat that's it's got very, very vague jaundice, or has it, and it's been vomiting perhaps twice a week, and that it's got to be like a fussy eater at the same time. So we all know that these cases need to be worked up, and we all know the broad routine, the minimal database. You're going to look for a urine sample, a blood sample, you might take x-rays, you might do ultrasound. There's a sort of standard route that we follow. But the big question is that as we do this, where do we get the information that we need to get? How do you know what to do? How do you know how to investigate mystery cases? Well, I've been thinking about this, and to me there's a few key things. And the first one, and probably the most important one, is your own brain. So this is a very important tool in your armoury. We obviously use our brains to get ourselves through our primary veterinary degree, and after that we know that we're all obliged to carry on continuing education, and that is so important. So as you go to different courses, you do online courses, you go to physical conferences, you read yourself, there's lots of different ways that you can continue to educate yourself. But by doing that, you're topping up all this information in your brain, and you're making sure that you yourself hold the most valuable resource when it comes to working up mystery cases. So that's the first starting point. The second way to get information for mystery cases is the brains of your colleagues. And I think that's one of the real benefits of working in a multi-vet practice, is that you can take your challenging case to people who work with you. In our clinic, we've got rounds every morning where we go through each of the hospitalised cases and talk about what's going on with them. But that can be extended, and often in the rounds, one of the vets will come up and say, well, actually, look, I've got this case that's not in this room with us right now, but I'm a bit baffled by it. Who wants to hear about it? Who can help me? And having a sort of case conference like that can be a really useful way of picking the brains of everybody in the building. Then the third useful way of investigating mystery cases is with textbooks. And I think most veterinary clinics have got a library of some sort with a whole bunch of different tomes of our favourite veterinary textbooks, whether they're medical or surgical. And having half an hour free during the daytime to sit down and go through the books and really concentrate on your case is a really useful thing to be able to do. So that takes me really on to the final way of dealing with mystery cases, and that's to use the online resource. I think it's really a remarkable aspect of our times that a complete encyclopedical resource of just masses of veterinary information is now available to all of us, not by having to go into the local university library, not by searching on Amazon for the latest textbooks, but literally by just searching online. But you need to know where to go to search online. And there are a number of different places that would include resources like VetStream, some veterinary discussion groups like this SPIVS group or BVA group or BSAVA, or some forums like the vetsurgeon.org forum. There's a few different ones like that. My own favourite is Veterinary Information Networks, VIN, where you pay a monthly subscription fee to have access to a vet-only network of tens of thousands of other vets. And so what I would often do is I would first of all use VIN to research a case, in other words to find out all about what I suspect, or perhaps to read about other similar cases that other vets have dealt with. But I would often then go on to write a full description of my case, including the full history, all the test results that I've done, including any diagnostic images that I've taken, and I would put the whole thing together into almost like a case report, really, and I'd submit that to an appropriate section of VIN, and it's split up into different discussion boards, whether it's oncology, cardiopulmonary, whatever, for dogs or cats or whatever animal it is. And then what happens is once you've submitted your case, you wait, and then due course, within 24 hours usually, a paid veterinary information network consultant, a VIN consultant, will read your case and they'll give you feedback. And as well as having useful ideas, if they feel that the assistance is needed from some other expert, they'll cross-post your case towards some other discussion board where somebody else then might come in and give you feedback. And I'll then, when I get notification by email that somebody's given me a comment on my case, and I'll then go back to the case, and I'll log on, and I'll give them some feedback. And there's often a bit of toing and froing until we agree on the next step in the investigation and treatment process. And the VIN network is very good also at coming back to you, even like a week later, and saying, how are you getting on? How's it going? Or sometimes a year later, somebody's emailed me and said, whatever happened with that case that you worked up? What was the final outcome? So that's an online resource that I find very useful. I have to say there are many other helpful online resources out there, and you may have your own favourite one. But whatever you do, make sure that you investigate those mystery cases fully and properly, because at the end of the day there always is a unifying theory, there always is a definitive answer as to exactly what's going on with that animal, and you really don't want it to be at the post-mortem that you discover that. You want to find out beforehand so you can give the best possible treatment to your patient. So I'd welcome any comments you have about your own ways of investigating challenging mystery cases. Please comment below, and I'll talk to you again another time.